So our topic for our paper was on the importance of verbal communication in the dental office. And verbal communication is so important because we need this for things to run smoothly and for things to stay organized in the office. It helps with teamwork when everybody can communicate good with each other. And when you don't have good verbal communication, things can become messy and very unorganized, and it just makes things more difficult. So one of the first topics that we were supposed to mention in our paper was why words are important. And your words are important because you need to make sure that when your patient's listening to you, they understand what you're saying and what you're trying to get out and make out to them. What I mentioned in my paper earlier was that some words in the English language sound the same. They're the same word, but they have very different meanings. So you need to make sure that they understand what word you're saying and how you're using it, because it's very easy to get confused and misunderstand, and it's very important for your patient to understand what you have to say, and so that they understand what's going on in the procedure, or for home care instructions that they know what to do later on. You don't want them to get confused and misunderstand what you were trying to say. It's best to not use any technical or fancy dental terminology when you're speaking to your patients, because you want to make sure they can understand the words you're saying, or you want to make sure that they don't get frightened or stressed out by the words you're saying. For example, when you're saying, instead of saying like drill to drill the tooth, you could say prepare the tooth. That sounds less intimidating, and it won't make the patient stressed out. And for example, instead of saying needle, you could say anesthetic, so that you don't worry the patient by saying needle. You just want to make sure that you don't use any terms that they've never heard of or can't understand, or that they might be stressed out by. The next topic that we were supposed to mention in our paper was the quality of your voice. And this is mostly talking about the tone of your voice. You want to make sure you speak in a polite tone and make sure you're calm and relaxed when you're speaking to your patients. You want to speak loud enough where they can hear you and understand you and know what you mean, but you don't want to be too harsh or too loud when you're speaking to them, because you could really stress the patient out, and of course you don't want to be rude. This is important, especially during a dental emergency. You want to speak to your patient in a calm and collected tone. Make sure you're relaxed. You don't want to let them know that you're nervous or freaked out. You shouldn't be. You should remain calm, because if the patient's already sitting there shaking and rapidly breathing, you don't want to sound nervous or sound freaked out. You want to remain calm so that they can remain calm. Another important part of verbal communication is asking questions and knowing when to ask the right kind of questions. You ask questions to obtain information about your patient, and the more information you have about your patient, the more confident the dental team can work, because they know everything about that patient. And you want to make the patient feel comfortable and answer all their questions and make sure you ask the right questions. Knowing your patient is what really leads to successful dental treatment and makes both of you feel comfortable. So it's always important to just make sure you know everything. There's closed-ended questions and open-ended questions. You need to know when to ask which ones. So the open-ended questions are the ones that are more detailed, and that's where you'll get most of your information, and you'll kind of control the conversation. That's just any question that doesn't end with the response yes or no. Those are your closed-ended questions, the yes or no questions. Those are just used usually to confirm information and make sure you have everything. The next thing that we were supposed to talk about is nonverbal communication. This includes body language, posture, facial expressions, anything like that. So your attitude speaks volumes. If you're walking around slumped around all the time and you're never smiling, it looks like you don't want to be there, and you don't want to give anyone that feeling that you don't want to be there. You want to let your patients know that you care to be there and that you're there to help them. You also need to pay close attention to your patient's body language. You want to make sure that they're not sitting there sweating in the chair, shaking, or rapidly breathing. You want to make sure that they're doing okay and that they're not too nervous. You just want to look for any signs of distress, like the patient grasping the chair or anything like that. You want to comfort them and calm them down. And you never want to mumble to your patients. You need to speak clearly and calmly to them and make sure that they can always understand you. And maintaining eye contact is also key. That's very important. You want to make sure that you look them in the eyes and be genuine with them and understand them when they're talking and listen to what they really have to say. And you want to make sure that you're always smiling and that you look like you're happy to be there, and just be very understanding with your patients. So another thing that we mentioned in our paper was listening. And listening can be one of the harder forms of communication. So to gain all your information about your patient, you really need to sit there and listen closely and focus on the patient and just really hear what they have to say. Instead of sitting there trying to think about what you need to say next, thinking about the response to their question, you really just need to sit there and take in what they have to say, because you really could miss something. You don't want your mind to be wandering off somewhere and not focusing on what they're trying to get across to you. You don't ever want to get impatient or look like you're not listening or not caring. You just need to sit there and focus on them, and so you don't miss anything, because you can miss things. You don't want to have selective hearing, and you just want to respect them and listen to them and take in everything. So to improve your verbal communication skills in the dental office, you basically need to focus on which kind of words you're using. Just remember to not use any technical dental terms when you're speaking to your patients, and you need to remember to focus on your voice quality as well, your tone of voice, speak in a calm, collected tone, and be polite always. And you need to know when to ask which type of questions to gather as much information as you can. And you need to focus on your body language. Don't walk around everywhere slumped everywhere. Be sure to smile. Don't make any crazy facial expressions whenever you see something. Don't make a surprised face. You might freak the patient out. And be sure to always listen to what your patient has to say, and don't be impatient with them, and just always be understanding. So a few things that I guess that I could work on to improve my verbal communication in the dental office would be probably listening. After I read that in the book about don't think about your response to the patient while they're talking to you, I think I tend to do that quite a bit. The best thing to do would be to just sit there and really listen to what they have to say and not worry so much about what answer I should be giving them. And just remember to always smile. Your body language, facial expressions, just always have an extra positive attitude. I think it's hard sometimes to remember to smile always, so I could work on that. And just more conversations with patients, and just be polite all the time. And not that I'm not polite, but just have more conversations overall. Just working on your interpersonal skills improves relationships and connections. This is important for socializing and business. And just better understanding human behavior helps you to interact better with your patients overall.